At CME Aged Care Navigators, we're obsessively committed to teaching people how to get the support they need as they age. Did you know we offer a 1-hour personalised consultation where you get to ask us any questions relating to your or your loved one's situation? You'll find a link to book a Let's Talk consult in the show notes and on our website. Welcome to your Aged Care Compass podcast. We help you make sense of the Australian aged care system by having conversations about topics you've asked us about. We're joined by thought leaders, professional experts, and people just like you and I who talk about their experience in the aged care sector. Hi everyone, and welcome to today's episode. I'm Michelle, your host. My guest today is hand therapist Sarah Holdman. Sarah studied occupational therapy and has always had a deep interest in hand and upper limb rehabilitation. After completing her university studies, she pursued further training and clinical experience to specialise in hand therapy. Sarah currently works in private practice. She has worked with a wide range of patients, from those recovering from surgery or injury to individuals managing chronic conditions that affect hand function. Welcome to the show, Sarah.
Hello, thank you for having me.
Our pleasure. Our theme for this month is occupational therapy and, in particular, how an OT can support older people. First of all, Sarah, can you please give us an idea of what a hand therapist does and what qualifications they need?
Absolutely. So a hand therapist is a health professional who specialises in treating conditions affecting our upper limbs. So anywhere from the fingers all the way into our upper arm and even sometimes our shoulder. So our goal is to help people regain function, reduce pain, improve strength and mobility after an injury. We also work with people post-surgery or due to chronic conditions, so things like arthritis. We work closely with surgeons and doctors and other health professionals as well to support patients through their recovery and help them return back to their sort of daily activities. To become a hand therapist, you either need to complete a degree in occupational therapy or physiotherapy, and that's followed by usually additional training and clinical experience, particularly in the hand and upper limb rehabilitation, so specifically looking more towards that. Many go on to gain certification or accreditation in hand therapy, so we've got extra training that we have to do after university, and that usually involves sort of clinical hours, a set number that we have to do, and then specialised courses and exams.
Excellent. So how did you become interested in hand therapy as a specialty?
I wasn't exactly sure what path I wanted to take when I finished school, but when I applied for university, I knew I wanted to work in allied health. So after learning about OT or occupational therapy, I decided to apply and I enjoyed every aspect of my degree. So it wasn't until I completed the hands and upper limb unit, though, that I really sort of found my passion and really loved the course and the career pathway that I could take in that regard. I love how hand therapy constantly challenges you to learn more about the anatomy and the conditions and all the evolving new treatment plans that we can get or approaches that we can have. And it's a very creative field, so lots of splint fabrication. And there's nothing really more rewarding for me than seeing a patient's progress and knowing that you've really made a difference in their everyday life.
Oh, fantastic. Yeah, we love that kind of attitude. So what are the most frequent hand or wrist injuries you see in older people and what typically causes them?
So in older adults, one of the most common conditions or injuries that we see is a wrist fracture, and that's usually from a fall. So as people age, bones can become weaker due to osteoporosis or things just, generally reducing bone density. So even a simple trip that we could have had when we were in our 20s or as we were growing up can lead to a fracture. We see lots of arthritis, especially in the thumb and the finger joints. That's more of a gradual wear and tear condition, and it can really affect grip strength and make daily tasks more painful. So we see all types of arthritis, so not just osteoarthritis, but also rheumatoid arthritis and gout. Other common conditions that we see include soft tissue conditions like trigger fingers, which affect the tendons in our fingers, or more nerve-related, such as carpal tunnel syndrome, which causes tingling or numbness in the hand. So it's really a mix of many age-related changes, overuse, and sometimes just a really unlucky fall.
So, how do age related changes like arthritis, osteoporosis, or reduced circulation affect hand function?
Yeah, so age-related changes can have a really big impact on hand function. So with arthritis, especially osteoarthritis, the cartilage in the joints wear down over time. Unfortunately, our joints, particularly our thumbs, don't have a lifetime warranty. And so most to all people across a typical lifespan will start to see some level of wear and tear in their joints, which is what osteoarthritis is.
Yep.
This can lead to pain, stiffness, swelling, and sometimes changes in the appearance of our fingers and our thumbs. It can make really simple things such as opening jars or turning keys really quite challenging. As we get older, bone density can also change, which is where we might hear the words osteopenia or osteoporosis being used by our doctors. This means that our bones don't have the strength that they used to and are more fragile, so that increases the risk of having a fracture. So osteopenia is characterized the stage before osteoporosis, which is where there's less than normal bone density, whilst osteoporosis is the more severe condition. Both often have no symptoms, however, they can be caught on a DEXA scan. Reduced circulation can slow healing and lead to cold, stiff hands as well, so especially in the morning or with colder weather. They can also contribute to things like numbness and tingling, can make sometimes arthritis feel quite a lot worse, and it can affect just overall fine motor control. So things like writing, sewing, cooking can all become more difficult.
Wow. Okay. And are falls a common contributor to hand injuries in older adults? And if so, what kinds of injuries result?
Yeah, so falls are actually one of the most common causes of a hand and wrist injury in older adults. So as we get older, balance, vision, and reaction times can decline, which increases that risk of falling. When someone falls, the natural instinct is to put their hand out and to break the fall, which often leads to an injury in the hand or the wrist. The most frequent injury we see from this is a distal radius fracture, which is our forearm bone, but then towards the end, so quite close to our wrist. It can be quite painful and often requires immobilization in a cast or even surgery, depending on the severity. We also see scaphoid fractures, which is that small bone in your wrist, finger fractures, and soft tissue injuries such as sprains or ligament damage, even sort of swelling and bruising that can happen. In some cases, a fall can aggravate some pre-existing conditions like osteoarthritis, or even lead to nerve compression such as carpal tunnel syndrome if that swelling increases the pressure at the wrist.
Wow. Okay. And so what does a typical treatment plan look like for an older person with a hand injury or a condition?
The treatment really depends on the specific injury or condition, but there are a few common elements that we include when we're working with older adults. So first, we start with a pretty in-depth assessment at the start, going through pain, movement, strength, function, and I guess overall just talking about how the condition is affecting day-to-day activities and function. From there, we can really individualize the plan, but usually it includes something along the lines of having swelling and pain management, splints or some supports, exercises, activity modification, and education. So education is important for both our patients, but then also for their loved ones as well, so that everyone's on the same page and trying to achieve the same sort of shared mutual goal.
Yep.
The overall goal is usually to restore function, reduce pain, and help people stay as independent and as confident as possible in their daily lives.
Yep. Yep. And how do you balance rehabilitation with pain management? So especially for chronic conditions like osteoarthritis.
Balancing rehab with pain management is such an important part of what we do, because the chronic conditions like osteoarthritis, we're not just treating pain and stiffness in that short term, we're helping people manage it over a long haul, so over the rest of their life.
Yep.
The key is to find the right balance between rest and activity. So if someone does too much, or if we progress too quickly with the exercise plan, it can flare up symptoms, but doing too little can actually lead to more stiffness, weakness, and further loss in our independence. So we really focus on graded movement. So we start with gentle exercises and then slowly build up as tolerated. Pain management strategies are inbuilt from the start. So this might include things such as heat or cold therapy, splinting, and techniques such as joint protection and activity pacing, which can help people avoid overloading their joints during daily tasks. We also spend time on education and reassurance, so people understand what's happening with their joints and feel more confident with managing future flare-ups. There are different types of pains that we can experience too. So it's also educating about what pain is okay and normal, so such as fatigue following strengthening exercises versus pain due to overuse or re-exacerbation of the condition. It's not always about eliminating the pain completely all the time. Sometimes that's just not realistic. However, it is about giving people the tools to reduce discomfort, maintain their independence, and prevent further wear and tear in the joints.
I love that, Sarah. That was really well explained. And I love the fact that you're making people feel reassured. That's fabulous. Yeah. So can you now then talk us through the role of splints, braces, or adaptive equipment in supporting hand function?
Yeah, definitely. So splints and braces are essential tools in hand therapy, and they're used to support and protect joints or injuries, as well as reduce pain and prevent further damage. So they come in various types of materials. We have lots on offer, and they provide different level of support. So some allow partial movement and others fully immobilize a joint to allow rest and healing. So for instance, a thermoplastic splint might be used to stabilize a joint. So they could be affected by a fracture or tendon, and we use them to fully immobilize. These can be removed for hygiene purposes. So they are rigid like a cast, but you can take them off. And their wear time can vary from being full-time around the clock, including at night, to just every now and again for provocative activities, depending on the condition. In contrast, for someone with mild osteoarthritis, a softer neoprene brace may be more suitable. This offers the joint more support during daily activities and can be worn as needed, so especially during provocative tasks, but it can be taken off as well. Adaptive equipment also plays a key role in supporting function and independence, so tools like jar openers, button hooks, and specialised utensils can help individuals with reduced strength or reduced dexterity perform activities more easily throughout the day. So ultimately, the goal is to match each person with the right splint or brace or device that meets their individual needs and lifestyle.
Forbes Care Occupational Therapy is a community-based practice supporting people across the Sunshine Coast, Gympie and North Brisbane regions. Their team of dedicated OTs provide functional assessments, home modifications, assistive technology solutions and therapy that helps people live safely and independently. At Forbes Care, they walk alongside clients and families, celebrating wins, navigating challenges, and ensuring every person receives the support they need to thrive. Sarah, how do hand injuries or conditions affect everyday tasks like cooking, dressing, or using technology?
For older adults, hand problems can really impact independence. So tasks that we might take for granted, such as chopping vegetables, buttoning a shirt, or typing on a phone, can become really painful or tricky. Arthritis or stiffness might reduce the grip strength or make the fingers less flexible. So handling small items or doing fine motor tasks can get much harder. Nerve conditions causing numbness or tingling in the hands can increase the risk of dropping items or being unsure of how hot something might be, which is particularly important with cooking, as it increases our risk of other injuries such as burns. Pain is obviously a big one too. So when completing daily activities can become painful, it causes a real disconnect over all areas of functional use. It can also really impact our sleep, which can further trickle on to leading a decline in social aspects of our life as well.
Yeah, pain is a big one. That's right. That, we often don't think about. Okay, so what strategies or tools do you recommend to help older people maintain independence despite having reduced hand strength or dexterity?
Yeah, so there are several effective strategies to support hand function and to reduce strain. First of all, I always encourage using adaptive tools. So things like jar openers, lightweight appliances and utensils with larger or ergonomic handles can make daily tasks much easier. If possible as well, not necessarily going through and replacing everything all at once, but if you're in the market for new taps, instead of replacing twist taps with the same twist tap, Using one that has a lever in the kitchen or bathroom can also help with reducing joint stress. Activity modification is another key approach. So, for example, looping shopping bags around our forearms instead of gripping them with our hands. Gentle hand exercises are also really important to maintain that strength and flexibility. So, even small, consistent movements can lead to meaningful improvements over time. And then lastly, education is essential. Teaching individuals how to protect their joints, pace themselves, and recognize early signs of strain empowers them to manage their condition more effectively. Together, these strategies help older adults maintain independence, reduce discomfort, and feel more confident in daily life.
Yeah, for sure. Do you work with older people who have dementia or neurological conditions? And how does that change your approach to hand therapy?
Yeah, so I do work with older adults who have dementia or neurological conditions, and it definitely changes the way that I approach therapy. With these patients, communication and understanding can be more complex, so therapy often needs to be more flexible and patient centered. I tend to focus on creating simple, clear instructions and incorporating activities that are more meaningful and familiar to the person rather than putting in like a formal exercise program. Sometimes the goals shift. It's less about regaining full function and more about maintaining the existing skills, preventing discomfort, and supporting safety during daily tasks. With splinting for fractures in particular, we may also discuss casting if there is a concern that they may want to remove their splint. I also work closely with caregivers and family members, providing education and strategies that they can also use to help with hand function and encourage participation. And overall, it's about adapting therapy to fit the individual's unique needs and abilities and support the quality of life in whatever way we can.
Great. Are there routines or sensory strategies that help with engagement or reduce distress during therapy?
Definitely. So, establishing a consistent routine between therapy sessions can really help, especially for older adults with cognitive challenges. Predictability helps reduce anxiety and makes it easier for them to know what to expect. So, having a regular time of the day as well that appointments are booked can also be a part of this. Sometimes simple things like playing calming or familiar music can create a more relaxed environment. In hand therapy in particular, it's typically an open plan setup where there may be two or more therapists treating in the same room. If this is overwhelming for someone, we can always book the appointments at a time that just allows for one-on-one, or make sure that we're in a separate room so that we can keep the noise to a minimum. The key is to tailor these approaches for each person. So noticing what seems to comfort or motivate someone so therapy feels positive and supportive rather than overwhelming.
What are some early signs that someone might benefit from hand therapy even before an injury occurs?
Great question. So for older adults, it's normal to notice some changes in our hands over time, but there's definitely early signs that tell us to pay closer attention. So for example, if you're feeling stiffness or weakness in your fingers or wrists, especially in the morning, or if your hands are feeling quite weak and you're finding yourself dropping things more often, those are some key signs. Numbness or tingling in your fingers is another one that shouldn't be ignored. It could mean that a nerve is irritated. Sometimes people notice swelling or mild pain during activities like cooking or gardening and think it's just normal aging, but it can actually really be a part of something that hand therapy can help with. The great thing about catching these early signs is that hand therapy offers simple exercises, stretches, and sometimes splints to keep your hands strong, flexible, and pain-free, which helps you keep doing the things that you love.
Yep. Do you only see people when they have an injury, or do you support older people to improve function and mobility in their hands as preventative therapy?
Yeah, of course. Hand therapy isn't just for treating injuries or recovering after surgery. For older adults, it can play a huge role in prevention and maintaining our upper limb health. We often work with people who don't have a specific injury, but are starting to notice things like stiffness, mild pain, or weakness in their hands. The goal there is to improve mobility, strength, and function before any major problem develops. Preventative hand therapy can include exercises, stretches, and advice on how to protect your hands during daily activities. and sometimes splinting as well to support our joints. This approach helps maintain independence and keeps hands feeling good for everyday tasks. So things like cooking, gardening, and sometimes even just playing with grandchildren can be things that can be quite aggravating.
Yep. Are there simple exercises or habits that older people can adopt to protect hand function as they age?
Absolutely. So one of the best things about hand health is that small, consistent habits can make a really big difference. And there are a few simple exercises and tips that people can do at home. So the first is finger stretches. So gently stretching each finger by extending it out and then curling it back in helps keep the joints more flexible. Heat before, such as a heat pack or completing the exercise after a warm shower, can really help with the feelings of stiffness. Grip strengthening as well. So squeezing even a car sponge or a rolled up pair of socks for a few seconds, then releasing can help build hand strength, and doing that for like a minute or two at the day. Warm up and cool down. So before activities like gardening or knitting, gently warm up your hands with stretches and then cool down with some gentle movements as well. I don't think we realize how repetitive some of these tasks can be sometimes, but even things such as simple as using a heat pack at night after a really big day of using your hands, or wearing gloves when it's really quite cold, so in winter, is really helpful for conditions such as osteoarthritis.
That's great advice, Sarah. And I'm going to let you in on a little secret. I was just doing my finger stretches as you were explaining it.
Oh, good.
So
You're
I'm doing
maintaining it.
So, Sarah, do you have any final thoughts or takeaways you'd like to tell our listeners?
Yeah, so my most final two takeaways are that firstly, if hand therapy is something that you feel either yourself or your loved one may benefit from, you are more than welcome to attend without a referral. So we see many patients who have referred themselves to seek, their own treatment or care. So don't feel as though you need to book an appointment with the doctor first to attend.
Right.
Secondly, if you are considering hand therapy and you do have a chronic condition such as osteoarthritis, you may be eligible for a CDM or a chronic disease management plan. So these can be provided by your GP. So if you do have an appointment with them, feel free to discuss it. But they can allow you to seek up to 5 sessions per year with some subsidies from Medicare. So these conditions can include many things, such as arthritis in general. So it could be rheumatoid, it could be gout, it could be osteoarthritis, even diabetes or circulatory conditions fall under that chronic disease management. Many places also provide a seniors or pensions discount. So it's worth ringing and checking if that's something that applies for you as well.
Oh, fantastic. Sarah, it's been fabulous speaking with you today and learning how hand therapists can support older people to continue to be independent in their own homes. Thanks for taking the time to chat with me today.
Well, thank you for having me. I've really enjoyed it.
Oh, great. It's been a pleasure. And listeners, we will have another OT joining us next week to talk about driving assessments. So until then, take care. Thanks for tuning in to another episode. Do you have a topic that you'd like us to cover on an episode? Please reach out and let us know via social media or our website, seemeacn.com.au. That's seemeacn.com.au. All the links are in the show notes. And don't forget to hit the follow or subscribe button so you don't miss any of our upcoming episodes.